Good afternoon, everyone. This is Marty Voigt, the Interim Assistant Superintendent, and I want to welcome everyone here this afternoon. We are fortunate enough to have presenters from the Department of Education and the Department of Health to do a presentation today. They are going to go ahead and introduce themselves and start right into the presentation. And at the end, we'll have some times for questions and answers. Dr. Mueller, I'm going to hand it off to you. Thank you.
Yes, thank you. Good afternoon, everybody. My name is Heather Mueller, and I am the Deputy Commissioner with the Minnesota Department of Education. And we are really excited about having the opportunity to be here with you today to walk through some of the components of the Safe Learning Plan and answer some of the questions that you might have. I know you had submitted some in advance, and so we are going to be able to spend a little bit of time, and you should hear some of your answers to your questions in the presentation that we have today. And with that, I'm going to hand it over to Assistant Commissioner Huff.
Thank you, Dr. Mueller. This is Dan Huff. I'm one of the assistant commissioners at the Minnesota Department of Health. I'll just start by thanking all of you for all that you do. You are incredible heroes and provide such amazing service to all of our children and all of our families and the future of our country. I started my career as a high school science teacher. I taught in the classroom for 5 years. So I know just how hard your job is. So thank you for everything that you do.
I'm going to go ahead and pull up our presentation.
So education is directly tied to public health. We talk about social determinants of health. Social determinants are actually the primary driver in individual health and public health. And education attainment is directly tied to individual health outcomes. So education is important for all of us. And obviously, schools are a very important part of the public health system. It's where we connect with children. It's where we do critical screening. It's where we provide nutrition for so many of our children, and where you as teachers do so much of the what you notice and pass on and refer is often the first step of a child getting into the correct system to be provided the services that they need. So during this pandemic, we have a lot of children that are falling behind. They're falling behind in health. They're falling behind in education. They're falling behind in nutrition. And it's just one of the many tragic parts of this pandemic. Next slide, please. The CDC has provided a guidance for how can we best and most safely return to school. And there are 5 things that the CDC recommend for success in safely returning to school. Number 1 is the consistent and correct use of masking. We at MDH strongly encourage a mask and a face shield be used together for all staff. That provides an extra level of protection, and we encourage you to use that, especially when interacting with other adults. If you're both wearing the face shield and the face mask, you will help protect each other as well as yourselves. Social distancing to the largest extent possible. I know that this varies from school building to school building, but the largest amount that you're able to do, it provides more safety. Hand hygiene, respiratory etiquette, teaching those kids to cover their cough or their sneeze into their elbow. Cleaning and disinfection, and then contact tracing. And that's where local public health and MDH comes into play, and in making sure that if we have people that are infected, that we quickly isolate them and then quarantine their contacts so that we don't continue to spread the disease. We also talk, you'll see at the very beginning there, it talks about the number of cases per 100,000. Part of Governor Walz's dial back was to lower the case rate in Minnesota, and that was effective. We were up at alarmingly high levels, and we've dropped back down. We are still higher than we would like to be. And that's why continued vigilance on masking, social distancing, maintaining as much as possible, interaction only within our own household pod, and following the guidelines for businesses and everything else, and then also getting testing. Those are all important things as we continue to keep a lid from a whole Minnesota-wide perspective on COVID in our population. Next slide, please. Next slide. Thank you. So, oops, sorry, go back.
Oh, sorry.
Childhood well-being, I don't have to tell you this. We all know it's been very hard on families. It's been very hard on children, this pandemic. As families are stressed, as we're all at home doing, working from home or doing in-person learning, or just all of this, the strains and stress that COVID has provided us, it's increased domestic abuse, it's increased violence and emotional abuse in the home. And it's been a specific challenge for parents that are doing single parenting, that are folks that maybe have special education needs in their families, low-income families, BIPOC communities. Those people who are already disparately impacted are even more so under this pandemic. Next slide. Healthcare access has also declined for our children. Schools is just as I said at the beginning, you are the folks who notice things. You help establish you're kind of the first line of surveillance for our children's health. Our vaccination is down for children. Visits are down for children, and we're very concerned about that for children's health. Next slide. Early childhood screening is also down. Not surprising, if kids aren't in school or you're not in session, then we don't have as many children undergoing their early childhood screening. Next slide. I think we've all struggled with this. This is very difficult. I don't know anyone in the country who is not stressed out or feeling the symptoms, the emotional and mental health symptoms of this depression, or this pandemic, and that obviously impacts our kids. They sense how we're feeling. Next slide. Food security. Sadly, too many of our children don't eat unless we feed them through our schools. This is one more thing that our schools provide for our children, whether it be the school lunch or school breakfast program. Now, school districts and local public health and other organizations have just done an amazing job of continuing to feed our children during this period of time, but we know it's not ideal. It's not the same as having kids in school every day. Next slide, please. Child welfare, you as mandated reporters are often how child welfare learns that children are in trouble. So therefore, maltreatment reports are way down. Case management has been impacted because we're not able to do, or child welfare is not able to do in-person home visits as much. We also just know it's a lot more stressful on families, and therefore more likely that that stress will spill over into negative impacts on the children. Next slide. So this is obviously really important, I know, for all of you, as you want to know that you're safe going back to school. Now, I want to say that no setting outside of your own home is guaranteed safe during a pandemic. We are in a global pandemic. What we can do is mitigate risk, and we can mitigate risk in many ways. And some of the things that Dr. Mueller will talk about is how we are adding additional mitigations to protect you and to protect the students that you serve. I wanted to give this data because I think it's just important to see this is what we learned from last semester. How many children were infected and how many staff were infected. We saw that we definitely had elementary school kids attend while they were infectious. We had staff attend while they were infectious, and we had secondary kids and secondary staff attend while they were infectious. One of the tricky things about COVID is about 50% of the transmission occurs in asymptomatic people, that is, people that don't even know they have it. It's one of the reasons that the testing program that the state is providing for all teachers and staff is so important. We want to make sure that you have the opportunity to regularly get tested for COVID so that you can protect yourself, your family, and your friends. I think what's important about this slide is that there's not necessarily a difference in proportionality between secondary and elementary school as far as, you know, when kids or faculty attended, whether they were infectious or not. Next slide. Now, one of the things that we looked at, because there's a lot of ways that people can get infected. Are people catching it at school, or are they catching it out in the community? And can we separate that out? So what we did is we looked at all the numbers I just showed you in the first slide and compared it to, were those people or all the cases in faculty, staff, and in youth, was there a statistical difference whether they were in school or not? What we found was the peak and the sort of the community spread. And remember that peak we hit around Thanksgiving, that overwhelmed everything. And that the larger determinant of whether someone got infected with COVID or not was not whether they were in school, it was where were we as a state. If we were very high case rates in the state, more kids and more teachers were infected, just like any other population in the state. So what this confusing scatter chart shows is by mapping the folks that were infected while in school versus folks that were infected while out of school, show that there was no real strong correlation. A lot of caveats to these data, but it seemed like the bigger driver was community spread. How much of it is in the community, not how much is people are in school. Next slide. Dr. Mueller.
Yeah, thank you. And so just to talk a little bit about like going back and looking at where we are and then how it is that we got here, to talk about then forwarding to what the current safe learning plan and updates look like. And so just thinking about where we were prior to coming into the 2021 school year, is we knew that coming out of March is that we had our students move into a distance learning model incredibly quickly. You all modified and adjusted every plan humanly possible to be able to think about how is it you're going to be able to support your students at a distance. And we did that work then thinking throughout the summer about, based on the science, partnering with our Department of Health, learning more about the vaccine, or not the vaccine, that COVID-19, really thinking about how is it that we are going to be able to help to educate our students. And so one of the things that we know is that we needed to be able to develop a safe learning plan that helped to provide guidance to our school districts to help have a better understanding of how we could bring our students back. And so we're going to come back to this slide in just a minute to talk about why these learning model changes are important. But it does give you an indication of where we were as of last Friday. Before we went into the winter break, we had approximately 13% of our elementary schools that were in an in-person learning model or in a hybrid model. And that was primarily because we had a number of staff who had had to quarantine or had been infectious themselves or had family members that were infectious. And then we had even less than 13% for our secondary. And currently we're at 31% as of January 8th. And we'll talk a little bit more, like I said, about that. So when the Safe Learning Plan was written in July in partnership with the Department of Health, we recognized that there were really 5 things we had to think about, and 2 we wanted to prioritize over anything else. First was the safety, health, and wellness of our students, staff, and families. I mean, making sure that as you walk into that school building, that you have everything that you need in order to ensure your safety is the most important thing always. Hands down, always, that is the case. And then the second thing is, if we could ensure that, if we could strive to create every possible scenario where we could help to mitigate COVID-19 in schools, then we wanted to have in-person learning because we know that is best for our students. And if we had to differentiate within that, then we needed to be thoughtful about our youngest learners. We understand the implications of students who are not receiving reading instruction and math instruction and social emotional learning in their younger years, especially our pre-K through 3, and also those who have some additional identified needs, whether they are students who need special education services, students who are learning English as a second, third, fourth, fifth language, students who are maybe in the middle of a welding certification, and the only way that they were going to be able to finish their manufacturing and welding pathway was to actually be welding, and there was no other way to be able to do that. Really taking a look at some of those individual pieces and trying to be cognizant of that. And then we realized that we needed to recognize the differences between the potential spread among our different ages, knowing that and looking for, is it going to look different in our elementary students versus our middle school students versus our high school students? And coming out of March and coming into the 2021 school year, we didn't have an answer for that because we had not been in school yet. Also supporting the plan while making sure that we could have flexibilities. We know that across the state, there are a lot of things that are in common with our schools. And we also know that our schools are very different based on our communities, based on the students that we are teaching, based on the staff that we have doing that teaching. And so we knew that we also needed to make sure that we had some pretty common guidelines that help to maintain the structure, but also recognize the individualness of each of our communities. And then we had to take into account the disease prevalence at the local level. And given that, then our Department of Health worked to really think through with us, like, what is a process for us to be able to use to arrive at a decision about how do we even come back in the fall? So the first was to really determine, like, what is that data going to look like? What are we going to use since we don't have any data from where our students have been? And so they helped to develop the county level data. And looking at that county level data, it really gave us a place to start. It wasn't ever going to be the end. It was always going to be one component of data, but it was a piece of information that we needed because we didn't have anything else. And when you're moving forward in that data-based decision-making and using that approach, you really need to have a place to start in a baseline. So once we were able to have our colleagues at Health develop that the framework around the county level numbers, we then were able to think about, how do we have a consultative process, right? We don't want our school leaders and our communities out on their own trying to think through this, right? Leading and teaching and education is hard enough, but trying to also then become experts in health is something that's almost impossible, and that's beyond expectation. And so we worked to develop a regional support team structure, and we'll talk a little bit more about that in a minute. But that regional support team structure was developed in order to ensure that they could work with your district's incident command team to look at your individual communities, to look at each individual schools, and be thoughtful about what are the implications for in-person learning, a hybrid learning, or a distance learning model. And then really thinking about from there, using what we know about that best practices and really progress monitoring that data, looking at information that we have coming in every single week on that Thursday when we would have the county numbers coming out, to really give us an indication of where we were. And then as we had students and communities that were starting to move about, weren't as much in a stay-at-home model, we started to have numbers and data from the schools themselves and from each of our communities. And with those regional support teams, the partnership, in case you have not had an opportunity to learn more about that, in that is our representatives from the Department of Education. We have direct connections to the Department of Health. We also have utilized our regional service cooperatives, and they have a colleague who is there who also partners with our local public health, and they are able to provide consultations. And so our school leaders are able to reach out at any point in time to have conversations with them, either them alone with the individuals in the team, or to bring the incident command team to have conversations about a series of questions that helps to lead to helping to decide whether or not in-person, hybrid, or distance learning is appropriate. We also set that up because we knew that the possibility of having COVID cases in schools was going to be real, and we needed to also make sure that our school leaders had a place to contact immediately, to reach out, make sure that they had what they needed so that they could work and function and focus on school and the school community, while the remainder of the team really did all of the things kind of to make sure that they had everything they need in order to move forward with notifying families and making sure that our students and staff were continuing to be well. So we had a series of questions that we really kind of had our school leaders walk through in thinking about, not only are we thinking about this as we're opening school, but what are some of the things we want to continue to think about as we're making decisions about our learning models? And so these are just a couple of the questions, quite honestly, that we have with our regional support teams and the incident command teams to think through in these models. So as we worked through the fall and we're continuing to monitor and adjust, and we had districts who were making decisions about learning models. We also knew that as we were watching some of the other data, like Assistant Commissioner Huff talked about, really looking at what are the other pieces of information that we know about our students and what are we seeing? We are seeing a drop in maltreatment reports. And is that because there's a drop in maltreatment, or is it because we don't have educators who are able to help to supply that information? What does it look like for nutrition for our students? And although we are doing, and when I say we, I mean you, an amazing job of making sure that you're providing nutrition services for your students and for their families, like, do they have enough, and how are we able to support them? Our mental health supports and services, the counseling, the social workers, the school psychologists, school nurses, and support staff that you have in your housed within a school community are integral to our students and to our families. And I think that I think our communities knew the role that schools played in the lives of not only their students and families, but I don't know that they actually understood the role that it played in the community. And looking at the impact that it has had if you were in a distance learning model, and especially at the beginning when we all moved to that distance learning in a stay-at-home order. And so when we have consistently been talking about what it looks like to come back into reprioritizing that in-person learning, we have to take into consideration that there are health risks, which Assistant Commissioner Huff has talked about around the spread of COVID-19. And the more we've learned, the better we've gotten. But we also now have to take into consideration some of the other risks that our students are facing, and quite frankly, that our staff are facing when they are not in school. And so this is the point in time where we know enough about the virus to be able to be thoughtful about how do we have our students in person to minimize the other risks that are starting to surface, and also make sure that we are able to mitigate. And so that was what we really were striving for as we were moving back into an updated safe learning model. A couple of things that we were able to use in addition to the maltreatment components, talking about nutrition, talking about the mental health and safety of our students. What we already know as educators is the importance of school just in general. I mean, all of us went into education because we really want to be around students, because we really want to make sure that we are supporting them in their learning. We love our content areas and are able to share our passions in our content areas with our students. And we know that we are building those relationships with them and their families so that they are continuing to grow into the people that the wonderful people that they are about to continue to become. And so not having our students in school, we know that what we miss out on, especially in our early years, in our K-3, is not only the learning that they have academically, but interacting with you as caring adults and who are taking care of them and want to make sure that they're well. Also interacting with their peers, learning behaviors and emotions and attention, and the struggle with distance learning within that. Also, academically, we know that the role that reading plays in literacy, and the data that we have right around K-3 literacy specifically, that where students are not on grade level by third grade, the implications that can have. It is never a direct story, but we do know that when in a number of studies that when students who have dropped out, 88% of the students who have dropped out struggled with reading, and we saw that data in third grade. And so we know that this 10 months where our students have not had the opportunity to be face-to-face with you has been a struggle. We also know that doesn't mean that you haven't been doing small group instruction. You haven't not been listening to your students read. We know that you have done all of those things, but we also know the integral role of having the opportunity to be in close contact with you and to have that face-to-face relationship is important. So we really are learning more, and because we've learned more, we've been able to think about how it is that we look at the risks that are starting to elevate, as well as thinking about how it is that we would be able to mitigate those risks. And so that's where, in partnership with the Department of Health, we developed additional mitigation strategies, the first of which was implementing a rolling start for students to be brought back into the building, really being thoughtful about setting up the practice where you have a group of students who are coming back into a building, usually 3 grade levels, and those students and staff then can build their structures, their systems, their routines. We can watch data. We have a 2-week then window of data where we're able to look and see what that is looking like in any of the if there's any spread, and gives us a little bit of solid information before you bring in another group of students. We also executed the testing program where we made sure that all of our staff members who are coming into the building, whether you're an in-person model or in a hybrid model, you have the opportunity to be tested every other week to make sure that you are none of you or your colleagues are coming in asymptomatic, that we are trying to catch as much of this as walking into the building as we possibly can, because we know that you're practicing all of these mitigation strategies when you're outside of the building. Well, we also know that there are times when other people are not. And so you may be interacting with people who are not practicing those mitigation strategies in the way that you are. And so we really wanted to be cognizant of making sure that we had something to serve as a stopgap to give us this information. Also ensuring that we had face masks for every single student and staff member. Now, we did that in the fall. We made sure that we delivered those, but we also knew that there was the added component that the Assistant Commissioner Huff talked about, was making sure that we had face shields as well. And so by adding the face mask and the face shield, the Department of Health strongly recommends that you do that. We also have heard from our education communities and from the feedback that a number of people have concerns about wearing both. And so the face mask is the mitigation strategy. And what we know is makes that stronger is having the face mask on. But that is a decision that is left really at the district level to have that conversation about whether or not you choose to do that. And then even if your district chooses to move forward with a face mask, which is our primary mitigation, one of our mitigation strategies, you as a staff member can wear a face mask and a face shield, and those are being provided for you. If you are a staff member who provides direct services that are close contacts, that are for physical prolonged contacts, whether maybe you're changing a trach tube for some of your students, there is additional support and protective equipment that we are providing and have provided to ensure that you have all of the protective equipment that you need in order to do the work that you're doing with your students. And then also making sure that in your classrooms that you have the opportunity to stay 6 feet of distance from your student. And we know that that's hard. We know that our youngest learners like to be very close to us. And that's part of the routines that we need to be able to teach and continue to help to support. And then all of the mitigation strategies, I think that the Assistant Commissioner have talked about, was the washing of our hands and making sure that we're continuing to support that and build those into our students' days. We also thought and talked about like our physical education classes, making sure that although they are happening maybe outside, if they're outside, or whether they're happening in your gymnasium, that they are wearing face coverings because of the respiratory droplets. And I know Assistant Commissioner Huff could talk more about that. Our arts classes, things like art and music and media and STEM classes, right? Those can be housed or contained in a cohorted model in your classroom, and that is the goal, is to try to cohort as much as possible. But we also know that in some instances, it may be that there is more space, or the rooms are larger in your music rooms or in your art rooms. And so the movement that you have of students from one classroom to an art room or a music room would mean that they would have the chance to, one, have a little bit of movement outside of their individual classroom, and two, that there is more space for them to follow the updated guidance that the Department of Health has put out around each of these different special areas. And then also looking at our student support programs. While our goal is to consistently have some type of cohorting model, so that way your students are not intermixing, even if you're a 3, 4, or 5 section first grade, that really this first grade classroom is just this first grade classroom. We know that there are times when academically we do need to mix, whether that comes from students receiving special education services, and if you have a pull-out model, any type of EL services that are multi-grade, gifted and talented services that are multi-grade, and also counseling, where we recognize that you may pull groups, whether that's for behavior or for social emotional support, mental health, or or any other type of group where you would bring students together. We know that that's another really important piece. And so by pulling those groups together, it gives you the opportunity to then, however, stay 6 feet apart. We know academically that these are really important components. And so in that, then we need to follow a different set of those mitigation strategies. Meal times and making sure that our students have the chance to, some of our school districts prefer eating in the classroom because they prefer the cohorted model. Others feel like moving down to the cafeteria is appropriate. And within that, then it would be in the cafeteria, you're still in that cohort. Your students are hopefully sitting on one side of the table so that they are not facing each other. And those droplets are respiratory droplets are not going back and forth. They are not commingled with any of the other first grade sections, that they are distanced at 6 feet if possible, but because they are cohorted, if they are in that lunchroom, then they can be closer. But again, we really are trying to maintain that as much as possible. And then the in-person component. Since the beginning in July, the Safe Learning Plan has indicated that if we are in an in-person model, you do not need to have 6 feet of distance between your students. And so 3 feet is preferred, but it is also still not required. And that is because we have the additional mitigation strategies that have been added to within this plan to help to support the in-person model for all of our schools at the elementary, specifically at the elementary level. I talked a little bit about the rolling start and why it is that we would continue to do and have that in that way. And also thinking about the January 18th, and I want to touch base on the January 18th because I think it also answers a number of questions. And some of the questions that were asked is around like the vaccine. Why weren't we waiting until we get the vaccine? Well, there's a couple of pieces, and I'm going to start with the January 18th, and I'm going to finish with the vaccine component. First, January 18th was a determined date because a number of our schools had January 4th as the date to come back to school after their winter break. It was set in your calendars. We also know that coming out of winter break, we weren't sure what that was going to look like, if there was going to be a spike, and what families were going to be doing while they were on winter break. We wanted to set a 2-week like incubation period to give us the opportunity to see what was coming and how it was coming. We also knew that as we were working on this, that sports was also going to be resuming. Sports practice began on January 4th and games began on the 14th. We know the role that in some ways athletics played in also some of our schools and our students groups being quarantined. And so we wanted to see as they were coming back into session, what were going to be the implications. And so giving that 2-week time frame was the reason that we moved the rolling start to begin on January 18th. We also know that with the vaccine, although vaccine is available right now to people who are in 1A and it was announced on January 12th, are able to be given to our community members who are 65 and older. We don't have a solid date on when we are going to be able to start vaccinating our educators. And we know that we've been prioritized at the top of 1B. Governor Walz has liked to call educators and childcare workers like 1A plus. But the vaccines are not coming fast and furious. The vaccines that we are getting in are being distributed, but they are not coming as fast at this point in time from the federal government, and we don't have a timeline. It is a distinct possibility that we be given that time. We don't know when that's going to begin, and if we want to outweigh the risks, the other risks that we've talked about, we have to figure out ways to be able to do this safely, implement the mitigation strategies, and also consider, and work with the federal government to continue to try to get vaccines to Minnesota, so that way we can begin to vaccinate our educators and childcare workers. We talked about the COVID testing for our school staff. It is not something you are required to do. You're not compelled to do it, but it is an option for you. And we hope that you participate in that. So that way we can catch asymptomatic spread and, quite honestly, symptomatic spread. And the continuity. Most of the plan, quite honestly, did not change. The plan that we set forth in July is the plan that we have moving forward. We've always talked about in the full in-person cohorting our classes, allowing recess outside, requiring masks, and masks and shields being strongly recommended has been the addition. Staff maintaining 6 feet of distance from each other and from your students, following in all of the health parameters. If you can get 6 feet of distance, then that's great. So all of those pieces and the continuity in the 5-step process, right? You're coming back into to schools, we're going to continue to monitor your data. Your incident command teams are going to continue to work with your regional support teams, and you're going to continue to really partner on following the data that's in your buildings and in your communities. What's really changed is using the county level data as a primary point of indication. I mean, it was one of the most I think highly sought after moments when we had the opportunity to see in July, like, can we come back? And if so, what are we going to look at? So when we talked about those county numbers in that July press conference, it was one of those things where it's what everybody heard, because that was what we were waiting for. And families were waiting for, educators are waiting for. How are we going to know? And then how do we correlate that? That a lot of the rest of like what was in that plan may have gotten lost. But always in this plan has been the expectation that the county numbers were always a start. It was never going to be the end. It was always going to be looking at your school level data, looking at your community level data, and then also then using the county level data as a third piece of information. Mike Osterholm, who's a leader, health leader, not only in the state of Minnesota, but also nationally, has talked about what they're seeing with the virus. And so has Assistant Commissioner Huff talked about that what we're seeing in the virus for elementary students. He has said that, we stop talking about kids and start talking about those that are younger than 10, because we're seeing a very different epidemiology in that group of students than we are seeing, for example, in our high school students. Finally, we never do anything in a vacuum, right? As great educators and as great health leaders, we have to look at those around us, right? We aren't the only people who are experiencing a pandemic. We have other states and we have other countries that are going through this with us and who have gone through this. Quite honestly, they are steps ahead of us because they had the virus spread in their country or in their states earlier than it spread in Minnesota. And so looking at other countries, looking at other states, looking at their case counts, looking at their dates and their mitigation strategies and the information are all things that we have continued to look at and will continue to look at as we walk down this path. We are very hopeful that the pandemic is going to end soon. We are hopeful, right, that the vaccine is going to help get all of our students back in to our buildings and get all of our staff back into our buildings. But we also know that in the meantime, while we are working through all of this, we need to find ways to have mitigating strategies to help to support our students coming back into our buildings if they have not been in, and for those schools that have been in since the fall, how do we continue to keep them safe? And I think that is the end.
And Heather, do you have a few minutes for questions?
I think I can. I don't know if Assistant Commissioner Huff had. I think that Stephanie Graff can as well. I think he may have had to step off.
Okay.
I think I can maybe give it a couple of minutes. I know we've gone a little over, but we really wanted to be thorough because we know it's really important.
All right. I'm not quite sure, but I'm going to go ahead and read the questions. There was a report that only 32% of vaccination doses received in Minnesota have been administered on Wednesday. Can you speak to this?
I don't know. I don't know that I can, right? I think that falls really more in Assistant Commissioner Huff's, and I think he may have had to step away. I'm not sure I see him.
Yes, he did. It looks like, so we'll take that question and put it into our Q&A. And if you would have, we'll get an answer and then we'll get it posted.
Sure. I think on the side note, like I do know that the government, our Department of Health, as well as our vaccine task force is really working with our local public health officials, hospitals, and our personal providers to make sure that that is being distributed as quickly as possible. And so I know that there are a number of things that are happening along the way, but I cannot speak to that individually.
Thank you. Well, I want to thank all three of you for attending today, and thank you for your time. I also want to thank all of our staff that have attended and taken the time to join us during this webinar. We will be posting the recorded session to our webpage. We also want to ensure that people go to the website to look at our frequently asked questions. And if you have additional questions, please ensure that you're working with your COVID coordinators in your buildings. And if they are unable to answer their questions, the COVID coordinators, I'm talking to staff, they know where to push those questions forward to, and then we'll get those response back to you. And I want to just thank everybody once again for their time today.
And if I may, I just want to take this opportunity to say thank you. We know the amount of work that this has taken for all of you as educators, and I myself as a mom. I am a mom of a senior in high school and a sophomore in high school. My husband is a 6th and 7th grade math teacher. I've been in education for 25 years, and we just want you to know that as we are working with our Department of Health, like our Department of Health colleagues also have students and children and and significant others who work in education. And at every moment, this is what we are thinking about. We are always thinking about your health and your safety and your wellness. We are always thinking about how is it that we could try to help our students be back in school, which is where we want them to be. We want to build those relationships because none of us went into school and this did not be with them. But we also are doing this to make sure that that you yourselves and your families are safe and well. And so just understand and know that at every point in time, we may not get everything right. Our goal is to always be better at the end of the day than we were at the beginning of the day. And we are probably in a much better place now. We know more now than we did last March. But we are always thankful for you and your partnership. And we are deeply appreciative of everything that you have done, always, but especially now.
Thank you, Dr. Mueller. Thanks, everybody. Have a good Friday and a good weekend.
Thank you.
We appreciate the time spent here together.
Thank you.